So I'm going to talk today about 5 myths about pregnancy and exercise. Before I get into the myths, I just want to make a general statement here that exercise is not a one-size-fits-all thing when it comes to pregnancy. Okay, there's no perfect way to exercise for every person. Even if you've have been pregnant multiple times, the way you exercise may change between pregnancies. Okay. Other thing is just to always make sure you consult with your physician or OBGYN before you start into any exercise program, or if you're a current exerciser and pregnant, just to make sure they know what you're doing as far as exercise and make sure that it's still safe. Okay, so always talk to your doctor first. All right, so we're going to get into these 5 myths. So myth number 1, lifting weights is dangerous for you and your baby. That is simply not true, okay? There is truly no upper limit of how much weight you can lift when you're pregnant. However, the only thing that would change that is if you're new to exercise or you are put on some precautions from your physician. So lifting weights is not a problem during pregnancy. If you are lifting weights before pregnancy, you can continue to lift weights during pregnancy so long as it's safe and deemed appropriate by your doctor. If you have not been lifting weights, you can actually start lifting weights during your pregnancy, and we'll talk about a little bit of that later on. Research has shown that women who actually exercise on a regular basis during pregnancy have shorter labors, have less complications, they have better postpartum outcomes. So there's lots and lots and lots of benefits to strength training and exercise while you are pregnant. Myth number 2, you will increase your risk of injury if you exercise while pregnant. Okay, so I know a lot of women aren't sure how to exercise safely when they're pregnant. So properly done exercises can actually prevent issues from coming up during pregnancy and actually minimize. Even if you have pain or aches or those types of things that come up in pregnancy, exercise can actually prevent or minimize some of those things. You need to keep your body strong and stable when you're pregnant. As the belly grows, as the baby's growing, as your body's changing and adapting to pregnancy, it's important to exercise so you stay strong and stable. Some of the things to avoid if you are exercising, exercises to avoid is if you're exercising and a movement hurts. Okay, probably not the right type of exercise for you. If you are exercising and you leak urine or you leak stool, hi Brooke, you should avoid or change that exercise. If your belly bulges out, not it's pushing out, not pulling in, even more than that pregnant belly, you should avoid or change how you're exercising. And the last thing to really change up is if you're feeling heavy kind of in the vaginal or perineal area, you might want to change up how you're exercising or avoid that particular movement. So, with any exercise across the board, listen to your body, don't push it. And if you're having symptoms, it might be time to change what you're doing. Myth number 3, you should only walk or do prenatal yoga. Okay, if you love to walk and you love to do yoga, awesome, do those things. If you don't love to walk and you don't love prenatal yoga, do something different. Okay, there's no one best way to exercise during pregnancy. This is not a one-size-fits-all. Like I said before, there's not a prescription for every pregnant woman on how to exercise. You need to do what feels good in your body. Okay, so just like I said before, if you're feeling any of those negative symptoms, then you need to change and modify what you're doing. You might find that with every stage of pregnancy, you are modifying or adapting how you exercise or picking a completely new way of exercising, and that's okay. As you're listening to your body, you may find that you have to adapt and change over time. And as long as you're keeping active, that's what matters, okay? Number 4, myth, avoid laying on your back exercises, or what we like to call the supine position. A small amount of time on your back is safe so long as you're not feeling dizzy, uncomfortable, short of breath, or just in pain, okay? If you're feeling in pain, short of breath, dizzy, any of those symptoms, lying on your back exercises are not going to be recommended. However, if you are able to lie on your back, those exercises should be very brief. And you should not add a lot of weight or extra load to your body in those positions either. So long as you're comfortable, you're fine for short periods of time. If you're not comfortable, pick different positions. You can actually wedge yourself up a little bit on an angle. So if you are lying on your back and you're dizzy or you don't feel good, but you still want to do an exercise lying on your back, grab some pillows, put them between your head and your upper back so that your head and your trunk are at an angle. So we call that a wedge position. They even have some wedge pillows out there that you can purchase and use those to position so you're not so reclined, okay? So that could be a nice tip if you're having an issue. Otherwise, just avoid them entirely if you're having symptoms. Myth number 5, if you've never strength trained before pregnancy, you can't start, okay? I kind of talked about it a little bit before. That is not true. Even if you haven't strength trained before, you can start strength training while you are pregnant, okay? You are not going to start with 100-pound weights, okay? You are not going to even start with maybe 10-pound weights. You are better off to start into some kind of strength training while you are pregnant, just going at a very gradual pace, okay? Body weight exercises are great places to start, with some squats, wall push-ups, very easy exercises that you don't have to do with any extra load added to your body. Resistance bands are another fantastic way of strength training without adding too much weight to your body. So that's one thing, here at Legacy PT that we love to do with our pregnant mamas is teach them ways that they can move and continue to strength train and feel good in their bodies, even for those who've never exercised before. So it's better to be safe and talk to a healthcare professional or a trained women's health physical therapist so they can help guide you as far as what types of exercises are going to be good movements and safe movements for you. I'm going to give you a bonus tip. Okay, so 5 myths and a bonus tip. I always tell my pregnant mamas, make sure you're considering the risk versus the reward with your exercise. So if you're exercising and you're questioning, should I be doing this? Could I be doing this? Maybe the answer is no, okay? This is not a time to get our egos really high, okay? If you're a runner and then you're having trouble running during your pregnancy, you may not be able to run during specific stages of your pregnancy. If you're a heavy weightlifter and then you have to lower your weights, it's okay, all right? We're listening to our bodies while we're pregnant so that we have the best pregnancies for us and for our babies. So sometimes what we think we should be doing is not actually what we should be doing. So if you're questioning what you're doing, or you have that little thing in the back of your mind saying, this might not be good for me, you're probably right. Listen to that inner voice. You should feel good about the exercise that you're doing when you're pregnant, and your body should feel good. So if it's continuing to feel great and you're feeling great and your doctor has never said to stop, then keep going.